Have you ever heard of a high flow therapy or a high flow device? In this video, I'm going to discuss what it is and when you should use it for your patients. Before we dive into the theory, let's quickly look at what a high flow therapy is made up of. A high flow device consists of a heated, humidified circuit that is connected to a bag of sterile water, an oxygen tube that is connected to a flow meter, and a breathing circuit that can be used either with a mask or a nasal cannula. Now, most ventilators do have high flow mode, although the setup is slightly different, but the theory is the same. So let's look into this together. There are three main settings of a high flow therapy. In no particular order, the first one is temperature, which range between 31 to 37 degrees Celsius. And this is somehow in line with our body temperature. The higher temperature you set on this device, the warmer the air gets. Temperature is mainly used for comfort, and it should be adjusted according to the patient's level of tolerance and their preferences. In saying that, be mindful of setting a high temperature for septic patients or patients who have got some sort of infection, because if their body is already febrile, adding extra heat can worsen their body temperature. This high flow device not only has a heated but also humidified circuit. Let me ask you something. Have you seen patients who have got a nosebleed while they are on low flow nasal cannula for a period of time? This is mainly because the oxygen that they are breathing in is dry oxygen, which irritates their nasal mucosa. High flow therapy, on the other hand, prevents this from happening by humidifying the oxygen as water vapor is mixed with airflow, stopping it from being too dry. Another key advantage of humidification is to promote sputum clearance, particularly for patients who are quite chesty but have a weak cough. Moisture from the sterile water will help loosen up the secretions, making it easier for the patients to cough up phlegm and clear their airway. If you ever used a nebulizer before, this function is the same as a nebulizer, but the humidification in a high flow therapy is delivered more consistently and more continuously. Let's move on to the second setting of high flow therapy, which is FiO2. FiO2 stands for fraction of inspired oxygen. This simply refers to the concentration of oxygen available in the air that is inhaled by a person and is calculated in as a percentage. For example, in room air, the FiO2 is 21%, which is what we all breathe in. And that standard 21% is the amount of oxygen that has been converted into a percentage. If you want to increase FiO2 above the standard of 21%, you can simply dial up the number on the flow meter, and this machine will automatically do the calculation for you by displaying the amount of FiO2 on the screen. You may be wondering, when should we increase FiO2? Well, given that FiO2 reflects the concentration of oxygen available in the air, we should only increase FiO2 when your patient needs oxygen, right? How can we tell? Well, this is when your patient is hypoxemic. And if this progresses over a period of time, cells and tissues are deprived of oxygen, known as hypoxia. Hypoxia or hypoxemia are best monitored based on the patient's SpO2 levels, or to be accurate, their blood gases, particularly their pH, their PO2, and their SO2 levels. Meanwhile, if your patients are hypoxic, they should be presenting with clinical signs of respiratory distress, including tachypnea, cyanosis, tripod position, pursed-lip breathing, increased work of breathing, and so on. High flow therapy can deliver up to 100% of FiO2, and as much as we want to give a maximum amount of oxygen to our patients, too much oxygen can also cause complications. One of the most common complications is oxygen toxicity, And this is when you administer high concentration of oxygen above the body requirements. And this in turn can cause damages to cells and tissues. Another common complication is oxygen-induced hypoventilation, particularly for patients who are CO2 retainers. As they are so used to having high CO2 levels, by giving them too much oxygen than what their body needs, you are essentially reversing their respiratory drive, which makes them stop breathing. This can lead to respiratory failure or, in severe cases, respiratory arrest. Therefore, oxygen should only be administered when it's clinically indicated. Let's look at the third setting of a high flow therapy, and that is flow rate. Flow simply reflects how fast the air moves from an atmosphere, passing different parts of the airway, and reaches the bottom of the lung, which is the alveoli, over a specified time. If you know what alveoli does, it's an area where gas exchange happens, an exchange between oxygen, which is absorbed as we breathe in, and carbon dioxide that is removed as we breathe out. In other words, flow simply refers to the speed that it takes for the air to move in and out of the lung. So we are talking in seconds here, and that is known as ventilation. In healthy adults, we usually generate between 30 to 35 liters per minute of flow rate, and that standard 30 to 35 liters per minute allows efficient ventilation and optimal gas exchange. However, in patients who have got acute respiratory failure, such as ARDS, asthma, exacerbation of COPD, they are struggling to generate a 30 to 35 liters per minute of flow rate due to the physiology of their conditions, including inflammation, bronchoconstriction, bronchospasm, airway resistance, and so on. This also means that these patients cannot breathe in fast or deeply enough so that they got impaired ventilation. As air is blended with oxygen, so breathing in less air means that there will be less oxygen at the alveoli available for gas exchange. In this case, oxygen demand is higher than oxygen supply, and the patients will be presenting with clinical signs of respiratory distress, the same as hypoxia as what we have discussed previously. This is when high flow therapy becomes helpful. Let's say if I set the flow rate on this device to 40 liters per minute, I am essentially giving my patients more than what their body usually generates. High flow means high pressure, and this pressure pushes air against different parts of the airway or any potential barriers, washes out carbon dioxide, and pushes oxygen that is trapped along the airway and helps it reach the final destination, which is the alveoli. As a result, the patients do not have to work really hard to breathe in, so they are not in air hunger or they are not gasping for air. Hence, we should be seeing a reduction in their work of breathing, an improvement in oxygenation and gas exchange, an improvement in lung compliance, and a removal of CO2. You can see how flow rate significantly impacts oxygenation. So ideally, if your patient is hypoxic or show clinical signs of respiratory distress, you want to increase FiO2 for the time being, and you can titrate the amount of FiO2 that you are giving to your patients accordingly once you get their blood gas results. I would like to take this time to emphasize the importance of early escalation if your patients show clinical signs of deterioration. We do need to get to the bottom of this as to why and what is happening. Timely treatment addresses the potential causes of your patient's signs and symptoms, hence promoting speedy recovery. This high-flow device can deliver up to 70 liters per minute of flow rates. And the key advantage of it is PEEP, positive and expiratory pressure. We are not discussing about PEEP in this video, But just to give you an idea in relation to this context, approximately 10 liters per minute of flow rates equal to 1 of PEEP. So in total, we have 7 of PEEP. If you do your own research, there are so many benefits of PEEP. And as much as it helps in terms of recruiting alveoli, improving oxygenation and gas exchange, preventing lung collapse, it can also do harm to our body. Let me give you an example. Imagine if you are squeezing a water bottle. The pressure within that water bottle increases as you are squeezing it, and it will reach to the point that the water bottle explodes. The same theory applies here. Too much pressure or volume can cause damage to our delicate alveoli, which is known as baro or volutroma, and we do not want that to happen. Another downside of high flow rate is that high pressure air is not always comfortable for the patients, and this in turn can cause irritation to their nasal mucosa. We have now reached the end of this video, and I hope it helps you understand when and why we use high flow therapy for our patients. In summary, high flow therapy should be used to maximize patient comfort, to promote sputum clearance, and to address hypoxia or any clinical signs of respiratory distress. Thank you so much for watching. If you have any questions or comments, please leave them below. Otherwise, I will see you in the next video.